Good afternoon, everybody, and thank you for joining the fourth action period call for the Injury Prevention Plus SEEK program. Very thankful to have you all here and can't believe we are almost halfway or a little bit over halfway of the program. You guys have been working hard and I appreciate you. Thank you to our program partner, the ODH Violence and Injury Prevention Section, or VIPS. And this is the ODH disclaimer. Just a little plug for Ohio AAP happenings. Coming up on April 19th is our spring education meeting. We would love to see you in Dublin, Ohio. We have good topics including ADHD, lead prevention, and this is free to members and partners. The address for more information is ohioaap.org/spring meeting, or you can email me and I can send you good information. And then speaking of lead prevention, we have lead poisoning prevention board books available. So you can request a box of board books. Thanks for keeping me lead free. That address is ohioaap.org/leadbooks, or you can also see me for more information there. So the agenda today, we have a packed agenda, very thankful. Welcome to all of you. We have a data review. We'll hear from Judy about Cribs for Kids. She is returning to share good information. And then we will hear from Bianca at March of Dimes. Okay, if you can safely do so in the chat, please share your name and practice name. And Zainab, did you happen to hop on? Okay, I will have your data today. So this is a look at the aggregate data for Wave 5 of SEEK. So the trend is continuing. We are up to February for the data collection. So we're starting with social needs. This is broken down by screening and counseling. And you can see that you have your baseline data collection kind of on the left, and then we started the QI active month starting in December. So there were kind of mixed data points for the screening for both age groups during baseline, and then it has gone up and held at 100% for the active QI months. Same trend for counseling. For family needs, we have a similar situation. So baseline, you can see was kind of trending higher for the birth to 12 months age group, and then 13 months to 5 years was brought up a little bit in April. And then since we started the program, it has been riding high at 100%. And counseling still in the 90s and 100s for both age groups, which is a positive trend. For home safety, kind of some interesting and kind of different fluctuation for the counseling piece for home safety. Not sure what is contributing to this. It is still within goal and well above what metrics we are looking for. But the 13 months to 5 years age group has dipped slightly, but nothing to be concerned about. And car seat safety, screening still is riding high at 100%. And then counseling, we appreciate that there are challenges with time in the office during the visit. There are a lot of topics that could be identified as needing a discussion for higher risk. So birth to 12 months for car seats, which is the critical kind of time for babies to be in a car seat, is being counseled on. And then 13 months to 5 years is at 86%. And safe sleep. We are only looking at the safe sleep metrics for the birth to 12 months age group. We are at 90s or 100% for counseling, and then 100s for screening. So thank you for that. And then resources provided, great metrics here. This chart starts in December, goes through January and February, and it has ticked down a little bit, but again, nothing to be concerned about. If you need more resources at any time or need anything from me, please let me know. And then we are collecting data as part of the caregiver feedback survey piece. So kind of that third section that we ask you and the families to kind of go through the whole thing. This last section is reflected in the data here. So the caregiver feedback survey, vast majority of caregivers have a likelihood of making a change. They plan to make a change, and then very few don't plan to make a change. So this is positive. Same with likelihood of change. The majority are ready to make a change or seriously considering. We appreciate that. They may just be presented with this information at the visit. Hi, Zainab. No, that's okay. They can be presented with this information at the visit, and it's all kind of new, and they are taking it all in. So they may be considering change, but they may be more likely to make a change in the next visit when they learn more. And then families willing to implement behavior change. This is also very positive. So families, again, the majority are very willing to change. And this is taken from the families who filled out their caregiver feedback survey. So we are very excited to see the positive thoughts around behavior change in terms of the SEEK program. And any questions for me or for Zainab now that she's available for questions? As far as your individual data, I will be sending that out this Friday. Okay, hearing none, seeing none, we can move forward. And Judy, thank you so much for joining us today. And I have your slides for Cribs for Kids.
Great. Thank you so much, Brooke. I'm so happy to be with the Ohio AEP again this year to talk about our Cribs for Kids program. And I want to tell you that Ohio Department of Health is one of our biggest participants in the program, and we're so thankful to have them. And we're shipping cribs and kits out every day from our office here in Pittsburgh to various places in Ohio. So we know that infant health and safety are really a big priority for all people in Ohio. So thank you again. Okay, so I'll start talking about Cribs for Kids for those of you who don't know us and don't know about SIDS or SUID. There are about 3,500 deaths a year that are attributed to sudden unexplained infant death. It's the #1 cause of infant mortality after the first month of age. And those numbers, thankfully, since the time I became involved, have come down from about 10,000 a year. So we are making progress, but we're at a plateau at this point where we're not seeing a lot of movement in the numbers. So your work in Ohio is so important to us. Next slide. Okay, the next slide. Our mission statement at Cribs for Kids is to provide infant safe sleep education through preventive programming, supportive research, safe sleeping environments for those in need, and bereavement support services to families who have experienced loss of an infant due to SIDS or other sleep-related deaths. Next slide. Cribs for Kids began as an offshoot. It was actually just a program of our organization. I was executive director of SIDS of Pennsylvania. And at that time, back in the early 90s, we were basically a support group for families whose babies died because we really hadn't identified any risk factors for why these deaths were happening. And then in 1992, we all know that at the International Conference in Sydney, Australia, a study was released that Australia, New Zealand, and the United Kingdom had done a study where they put babies on their backs to sleep rather than their tummies. And in 3 years, their SIDS rates had come down by about 50%. So I came back to the States after attending that conference, and I was so excited that we had something to tell our parents. Almost immediately, within a couple months, Dr. Marion Willinger from the National Institutes of Health was on the Today Show talking about the study. And within 2 years, the American Academy of Pediatrics put out a directive that pediatricians should tell parents to put babies on their tummies rather than on their backs rather than their tummies for sleep. And 3 years later, we saw a 50% decrease in the number of SIDS deaths that were being diagnosed throughout the country. So that had taken our rates in Allegheny County from 54 a year, just in our county, down to 28 a year. And even though we were excited about that almost 50% drop in the rates, we were still upset that the babies that continued to die were mostly from low-income families. African-American families were being affected more than other demographics. And I asked our coroner, Dr. Cyril Wecht at the time, if we could look at the death scene investigations that he had done of those 28 babies to determine what, if anything, these babies had in common and why they were babies from this demographic were continuing to die. And as we did this study, we realized that 90% of these babies were in unsafe sleeping environments. And at that point, we hadn't really addressed where the baby was sleeping. We were just saying to put the baby on its back. So we took a leap of faith and got together with some of our county officials, our district attorney, the president of city council in Pittsburgh, the police department, and we began our program, Cribs for Kids. And as we developed this program, we saw something really important in Pittsburgh, and that is the rates continued to fall, even though rates around the country weren't falling as quickly. So by 2006, we decided to take our organization, our little Allegheny County initiative, and turn it into a national program. And at that time, we were ordering Graco pack and plays from Graco. And at that time, before Graco, we were ordering them. We were going to Toys R Us and buying them retail. And I realized that we really had to develop a program where we were buying the cribs wholesale from Graco and distributing them to our partners at discounted pricing. So by 2006, we had forged a relationship with Graco, and they were selling the cribs to us at greatly discounted pricing, and that gave us the opportunity to sell them to our partners at discounted pricing. And Cribs for Kids began. And that first year, I think we had 7 partners who were participating in our program. And now we have 2,000 partners nationwide who are doing the Cribs for Kids program. In the interim, we realized, okay, if you can switch the slides. In the interim, we realized that not only should we supply the cribs, but we had to supply education to these families so that they knew why we were putting babies into safe sleeping environments. So that began a whole new era for Cribs for Kids. We approached Graco about doing a pack and play type unit that had a message on it so the mother was reminded or the caregiver was reminded constantly about safe sleep. The ABC Alone on My Back in a Crib message, and Graco refused to do that. So we actually went to China and we found a distributor and a factory who would do our own Graco pack and play that we call the Cribette. So as we were doing education right in the homes through our Cribette, having the message, we started to realize that a lot of our partners didn't have the funds to keep the program up and to keep funding the numbers of cribs that they had. And I knew that the population that we were looking at were people that were involved in Medicaid. So I went to our managed care organizations here in Pittsburgh and asked them if they would participate with us and start an incentive program for their patients or for their clients that included a safe sleep survival kit which consisted of the Cribette, a sleep sack, pacifier, educational materials, the Charlie's Kids book, so that we could distribute them to these mothers if they attended their prenatal visits after 14 weeks. And we were very successful in getting our local managed care organizations to participate with us. And that began our managed care organization incentive program. Right now, we have about 22 managed care organizations around the country who are participating in the program and paying for these cribs and education for all of their clients. So then, next slide, please. In 2010, I had a bill passed in Pennsylvania, Act 73 of 2010, which made it mandatory for the nurses in the hospital to educate every mother after giving birth about the importance of safe sleep. And the mother would sign an acknowledgement that she understood the message, she saw the video. And in some locations, like Allegheny County, we actually supplied cribs to the hospital so that they could distribute them to mothers who, after seeing the message, said they did not have a safe place for their baby to sleep. That again helped to bring our rates down here in Allegheny County. And I had calls from other partners from around the country who would say, could you come to my state and pass this bill? And I've lived in Pennsylvania my whole life, and for 5 years, it took me walking through the halls of Harrisburg to get the bill passed, and I knew I probably couldn't be successful passing a bill like this in every state. So instead, I formed the National Infant Safe Sleep Hospital Certification Program. This program contains all the tenets of Act 73 of 2010. So we launched this program in 2015, and today we have certified over 500 birthing hospitals throughout the country. We award the hospitals bronze, silver, or gold designations, depending on how rigorous their program is. And we based all the rigor in developing this program on the most current American Academy of Pediatric evidence-based policies. So all of the people who are doing our programs in the hospitals are using the guidelines set forth by the AAP. Next slide. Another program we're proud of is our National Public Safety Initiative, and that's where we have people in the community, firemen, EMS, paramedics who are in homes, being our eyes and ears in the community so that they can identify families who don't have a safe place for their baby to sleep. And we provide these cribs in all of the precincts and firehouses around the city. And right now we have national public safety people all over the country participating in this program as well. Next slide. Our Safe Sleep Ambassador program is a free online safe sleep education training program that we launched in 2018. Right now, we have over 53,000 Safe Sleep Ambassadors. Anyone can get on the program on our website and go to Safe Sleep Ambassador and watch the PowerPoint, take the test, and become a Safe Sleep Ambassador. And then the participants are encouraged to share the safe sleep message with at least 3 other people. And we based that on a program years ago during slavery called Each One Teach One. So if you were one of the privileged people during slavery who were taught how to read, to pay back, you had to teach 3 other people to read. So we're hoping to spread the message that way. Okay. Our at-home program is an exciting program that actually originated during the pandemic in 2020, 4 years ago today, when all of our offices closed down. We were worried about the mothers who were being helped by health departments and hospitals throughout the country and given our products through those hospitals because we knew that they couldn't meet in person to receive their products. So we started a program called At Home, where when we got orders in from our partners, we actually shipped the Cribette or the Safe Sleep Survival Kit from our warehouse directly to the mother's house. For the education, that's how we started our Safe Sleep Ambassador program. The mother was to get online, take the education, become a Safe Sleep Ambassador, and prove to the hospital or health department that they were educated and that they would use the Cribette properly. Okay. Okay, and our Safe Sleep Academy, we just brought everything together on our website. It's all the education you would need. You can access it through this QR code. And we're in the middle of revamping it to bring it up to the 2022 guidelines from the AAP. But all the education is wonderful on there. We have a pediatrician, Dr. Eileen Tyrella, who is our Ask the Pediatrician. She's a board member. And so any questions that anyone has of this pediatrician, she'll answer immediately. Okay, next slide. Our Safe Sleep products consist, next slide, of our Cribette. Okay, you can go to the next slide. I think I covered how we came up with the Cribette. And it's exactly like the Graco Pack and Play, except the messaging on the fabric is ABC, alone on my back in a crib. It's a portable design, so it can be folded up and put into a carrying case and taken with the mother and the baby wherever the baby goes. It has the bassinet feature and mesh and all for sides, and we're really proud of this. So when Graco wouldn't do it for us, we just did it for ourselves. Next slide. We have our own line of wearable blankets. We call it the Snoozette. And the Snoozette in the cotton design has this ABC Safe Sleep message all over it. And in the fleece, it has it on the lapel. And it's lower priced than most of the other sleep sacks that are on the market, but the better, same quality. The Safe Sleep Survival Kit that I mentioned earlier includes the Cribette, the Snoozette, a crib sheet for the Cribette that has a safe sleep message, an ABC photo magnet, a Philips Suzy pacifier, the Charlie's Kids Safe Sleep book, and educational materials from Cribs for Kids. Next slide. We also have a baby shower in a box, which includes most of our products, except for the Cribette, and a lot of our MCO partners. If the mother has a safe place for her baby to sleep and doesn't need a Cribette, will opt to do this option because so many of these mothers aren't given a baby shower. So this makes a great gift for the mothers, and it keeps them going to those prenatal visits, which is so important. Next slide. We realized after a while that we were reaching out to low-income families in a very good way, and we were going through managed care organizations. But we had a young woman that came into our office to volunteer from an affluent family who really knew nothing about Safe Sleep. So we decided to open an online store it's a for-profit company that is a subsidiary of Cribs for Kids. We call it Etc. because all of our products, as maybe you've noticed, end in et. The Cribette, the Snoozette, the Snapette, etc., etc. So we came up with the name Etc. And all of our products can be sold on that site to the public. We can't sell to the public through our Cribs for Kids store. It's strictly for nonprofit organizations or other nonprofit entities and government agencies. So go to www.etc.com and you'll see all of our products. And it's a great way to walk into a baby shower with education actually printed on materials to get the conversation going about the importance of safe sleep. Next slide. Our safe sleep education. Next slide. We came up with a little miniature Cribette and Sammy and Sasha that go into the Cribette because we wanted to change the culture by selling this product to little girls who would, from the beginning, understand the importance of safe sleep. So this toy kit consists of a miniature Cribette with a carrying bag, a doll, a pacifier, a miniature Snapette, which is our onesie with a message on the front and the back, a Snoozette, the wearable blanket, and safe sleep education for the little girl. So we we're excited about getting this out, and it's on our Etc. store. If you have a little girl who you'd like to give a great gift to, and an educational tool that will start her thinking about safe sleep for an infant from the beginning. It's on there. But what we found was our partners became very ingenious and said, oh my goodness, this is what we'll use in the hospital to show people about safe sleep and take it to the bedside and talk to parents about the importance of safe sleep. So it's become one of our best products, and we're really excited about it. Okay, next slide. We have our 12 steps educational materials, and they are all the new steps of the 2022 AAP guidelines. We have them in the size 11 by 17 that can be hung on office walls in pediatricians' offices. We have them as handouts. We have all the steps on a door hanger. So all of these are available on our site, and rather than recreate the wheel and try to create materials about infant safe sleep, you can just come to cribsforkids.org and order your materials there. Okay, next slide. Next slide. Okay, our Cribs for Kids conference is coming up May 7th to the 10th, and we're inviting everyone to join us. It's we're doing it virtually again. We did a survey after our last virtual conference, and the consensus was that more people were able to get to the conference and take part in safe sleep education virtually than coming to a place in person. So the registration is now open. You have until March 15th to get in on the early bird special. So we hope that we see a lot of people from Ohio at the conference this year. It's been really well received over the years, and so far our registration shows that a lot of people are excited about it and will be coming to participate with us. And we have a great agenda for the conference, so you're all welcome to attend. Next slide. Okay, so basically it's as easy as ABC 1, 2, 3. You take the Safe Sleep Ambassador training, you become a Cribs for Kids partner, you get your hospital Safe Sleep certified, you use our safe sleep products and educational materials, and they're available for translation. You attend our biennial infant safe sleep conference, and 3, you like, follow, and share Cribs for Kids on social media. And that's the best way to get these messages out. Just come to our social media pages and just share what we're putting out there. And you don't have to create a link of your own. You can just share it on your page. So we have a great social media manager who keeps our page very active. Next slide. So I'd like to thank you. I hope I got in the amount of time you gave me, Brooke. And here's all of our information. Please feel free to reach out for us for any reason. We're always here. And I look forward to participating again next year with you, Brooke, as we talk about how Cribs for Kids is progressing.
Judy, thank you so much. Wonderful to hear from you again and how Cribs for Kids continues to grow. I think that is wonderful. Wanted to let you know, and a reminder for the group, as part of the program, the Cribs for Kids resources on the caregiver handout. There is also linked to the resource website. And then we have been able to share as part of the program with our participating providers, the Charlie's Kids book and Sleep Sacks. So we call those tangible resources. So that is kind of a more robust resource share for this wave of the program. So happy to see those items listed on your presentation too.
Yes, in fact, those Charlie's Kids books come from our warehouse because we have offered to be the distributor for Charlie's Kids. So
well, that's
we
fun.
see all these books going out. So.
Yeah, just to stay away. I like that.
Yes. Great.
Thanks, Judy. Any questions for Judy or anything to share about how your safe sleep resources have been working? Or have you used Cribs for Kids in the past and have a story to tell? Okay. Hearing none, seeing none now, if you think of something, please email Judy directly or email me and I can transfer that information. Judy, thanks so much. It was wonderful to see you again.
Nice seeing you too, Brooke. Thank you.
Okay, Bianca, I have your slides whenever you're ready.
Great, thank you so much. Yeah, we can start. So hi everyone, my name is Bianca Zarders. I'm the Maternal and Infant Health Manager at March of Dimes. Today I want to share with you all a brief overview of what the state of maternal infant health looks like in Ohio compared to national data. I'll be speaking on 2 report cards today, our maternity care desert report card and then our annual preterm birth report card. Next slide. So just a brief overview, our mission at March of Dimes is to lead the fight for the health of all moms and babies. And next slide, our vision is we imagine a world in which every baby is born healthy, regardless of wealth, race, and geography. And we have 2 organizational goals. One is to end preventable maternal risks and death, and the other one is to end preterm birth and infant death. And to achieve these goals, we know we have to end the health equity gap. And so it's just something to keep at the forefront of our minds, as we continue to move forward with how to help children, how to help moms, and then, yeah, just to continue that fight for healthy moms and strong babies. Yeah, next slide. Let's keep going. Sometimes I forget that it does this sometimes. And so families face enough obstacles. Not getting the care they need shouldn't be one of them. And so you can go to the next slide as we discuss the maternity care desert report card. Today, I just wanted to give this brief overview on our national data. And so this is our national data. The red on the map signifies a maternity care desert. And 5.6 million women live in areas with low access to maternity care. And 2.2 million women live in maternity care deserts that have no hospitals offering obstetric care. And when you think about that as a whole, it's shocking data, because you think, as the US, don't we have hospitals? Don't we have all these things? But when it comes to specifically the obstetric care, specifically the maternity care, we are lacking in this nation. Next slide. And so I'm just going to go over some key findings in Ohio. And so maternity care deserts are counties where, oh, you can actually go back one. Perfect. Maternity care deserts are counties where there's a lack of maternity care resources, where there are no hospitals or birth centers offering obstetric care, and no obstetric providers. Next slide. So the maternity care desert report focuses on 4 areas: the percentage of women who had no birthing hospitals within 30 minutes, the percentage of women who received inadequate prenatal care, women who have a vulnerability to adverse outcomes due to availability of reproductive health services, and then as well as women with chronic health conditions who have a likelihood of preterm birth. And so in Ohio, 14.8% of counties are defined as maternity care deserts, compared to 32.6% in the US. Next slide. So as you can see here on this map, Ohio map, there was a 4.1% increase in the number of birthing hospitals in 2020 and 2019, which is good. And there were 4,113 babies born in maternity care deserts, which is about 3.2% of all births. And so as you can see, the red is a maternity care desert, the orange is low access, the yellow is moderate access. And then, for example, like I live in Northeast Ohio, and so there's a lot more like birthing hospitals in that region. Next slide. The next is the distance to maternity care. On average, women in Ohio travel 9.2 miles to the nearest birthing hospital. However, women living in counties with the highest travel times could travel up to 34.5 miles to reach their nearest birthing hospital. There was a story that came out when this maternity care desert report card came out, and they were interviewing, some women who live in maternity care deserts, and they were asking about, what's your birthing plan? They asked this woman, and she was like, honestly, I might end up giving birth in my car. And this is like a huge red flag, honestly, when I hear stories like this, because she's realizing that it could be miles till she reaches the next birthing hospital. And a lot of women end up missing their prenatal appointments because they have to choose between, groceries to feed their family versus gas for their car, not to mention arriving late for appointments, dealing with Ohio's moody weather conditions, finding help to take care of, any other children they may have. All those things are problem causes to why a maternity care desert is such an important topic of discussion, because if women can't get these appointments they need, or even get access to, when they're in labor, to go to the proper hospital, we can end up with really detrimental issues that could arise from that. Next slide. Another interesting thing about the maternity care desert report card is chronic health conditions. And we realized through a lot of data that chronic health conditions before pregnancy, it increases the risks of pregnancy and postpartum complications. And so preterm birth is one example of the complications that can lead to serious health impacts. The burden of chronic health conditions among women is increasing amongst the US. And at the time, women with chronic conditions and their babies may need access to higher level care, specialized providers, hospitals who have an ability to perform C-sections, or hospitals with NICUs. And so as you can see from this graph, 44.8% of women had one or more chronic health conditions. And those with a chronic health condition were 59% more likely to have a preterm birth. Next slide. So next, I'm going to go over our March of Dimes report card. And so again, this is the national overview of where we stand on when it comes to preterm birth in our nation. And so, where a mom lives could determine if her baby is born premature. And so as you can see, the grade for the United States is a D+. And this grade, the preterm birth rate, means a baby born before 37 weeks. And so, so when you think about these things, when you get a bird's eye perspective, you get really good insight into our country. And so, so as you can see, a lot of the country has yellow, which is like that D range. And then the West Coast tends to do pretty good with their preterm birth grades. With the green, they get like a A-, B+ range. And the South is what they really struggle with their preterm birth grades. Next slide. So here is our Ohio grade. There was a slight increase in our preterm birth grade from last year. About 1 in 9 babies are born premature in Ohio. And as you can see, we are higher than the national average. Next slide. Now, this graph breaks down the rates even more by aggregating out the data by race and ethnicity. As you can see, Black women are 1.5 times more likely to have a baby born premature than any other baby. I think it's important to note that these statistics are not necessarily a racial issue, but more so a racism issue. There are still healthcare stigmas, systemic racism, racial biases that all play a major role in the care for Black women and the outcomes of Black babies in our nation and state. Next slide. So this is a really powerful graphic on our report card because it really breaks down the factors of preterm birth. I think a lot of times when we talk about preterm birth, we're just like, so really, what is it? What's causing it? And so some of the factors include smoking, hypertension, unhealthy weight, diabetes, previous preterm birth, or carrying multiples. And when I think about the overall view of the maternal health, we can see that many birth outcomes are due to external factors. And so a lot of those external factors, you know, could also include depression, stress, and anxiety. Next slide. So early and regular prenatal care is an important strategy for reducing the risk of pregnancy complications and adverse birth outcomes. And prenatal care, you know, when I think about even by race and ethnicity and different BIPOC communities, they tend to receive services at a less likely rate, and including, you know, health screenings, appropriate monitoring for babies' growth, as well as environmental factors that can all play into prenatal care. And so this graph defines areas where women are vulnerable to poor outcomes due to the physical environment. And as you can see, if a Black woman lived in a higher vulnerability area, there's a higher likelihood of inadequate prenatal care compared to those living in low vulnerability areas. Next slide. And so next, as you can see, the infant mortality rate amongst Black women is 1.9 times the state rate. And some of the leading causes of infant death are birth defects, preterm birth accidents, and sudden infant death syndrome. And so 17.8% of infant death is caused by preterm birth, which is why at March of Dimes, we're so passionate about this topic. And yeah, so as you can see, especially when it comes to the infant mortality rate with Black babies, they're 2 to 3 times more likely, and that's very significant. Next slide. So the Maternity Vulnerability Index is a tool used to understand where pregnant women in each state may be more likely to have poor outcomes, including preterm birth and maternal death, due to clinical risk factors and other social environmental factors. And so, for example, stress, mental illness, and substance abuse can negatively impact the health and well-being of mothers and their children during and after pregnancy. And this is also the highest factor related to maternal vulnerability in Ohio. And I believe that pregnant women are more susceptible to mental health and substance use when you add in all the other factors that it includes as well. Next slide. So lastly, the mental health conditions, I would say, are the leading causes of maternal mortality, and they're one of the leading complications of pregnancy and childbirth. 1 in 5 new moms experience maternal mental health conditions, and 40% of Black women experience maternal mental health symptoms, nearly twice as many as the rate of all women. And I think it's just important that we bridge the gap in maternal mental health, healthcare as well, experienced by Black women specifically. And I think healthcare providers need to provide access to screening, support, and treatment for all pregnant women to address these maternal mental health conditions. Next slide. So this is just an overarching view of where we're at in Ohio when it comes to our policies. And, you know, we're currently working on the doula reimbursement policy that just passed a few months ago, which is really exciting. And then we still have work to do in the area of paid family leave. But I just feel really proud of Ohio that we have Medicaid extension and expansion. You know, we have our perinatal quality collaboratives. We have our maternal mortality review committee. We have all those things. And when I think about when we compare other states, I do believe that Ohio is, we're doing the best we can in this area, but there's always room for improvement. Next slide. So here are just some potential solutions, you know, when it comes to maternity care deserts, when it comes to preterm birth rates. And so, you know, some of them include, you know, optimizing telehealth offerings or utilizing mobile health units. Some other ones are, you know, educating women on how to advocate for themselves and their health, and addressing social determinants of health, which is what we talked about today, to reduce disparities and improve health outcomes. Next slide. You know, another thing is to improve hospital operations, like developing workforce and encourage rural opportunities, enhancing reimbursement for group prenatal care, requiring annual implicit bias training, which at March of Dimes, we actually have that. So if you are a hospital that would like, you know, to just dive deeper into this implicit bias and just make sure that all your staff has been trained in this area, feel free to talk to me and I'd be happy to see if we could set you up with implicit bias training. But there's just so many different ways we can improve the patient experience. Next slide. So this is just a call to action. These two QR codes are really great. So the first one, it says educate on the left side, and that's if you want to learn more about our maternity care desert report card. And then the one on the right is if you would like to advocate on a federal and state level on new policies. It's just a great way just to call on legislators to bring about change for maternal and infant health. And that is all I have. If you have any questions, I would love to answer to the best of my ability. Thank you.
Bianca, thank you so much. We have maybe all heard of March of Dimes, but I was not aware of the breadth of data you're collecting and programming that you have. Do you have, you're kind of a regional representative, Northeast Ohio. Are there other regional representatives? Is Ohio kind of broken down?
Yeah, so we have several staff who are in Cincinnati, and then we have a couple in Cleveland, but I'm the person, I'm the main one in charge of like the public health work or the mission side of things right now. So, so I also work on like a lot of the Ohio policy level change as well.
Any questions from the group on this good work? So we have a pretty good representation of Ohio throughout the participating providers for this wave of the program. We have someone from every corner almost. What is a good approach for our pediatric PCPs and healthcare providers to meaningfully approach adversely impacted families? So all the preterm birth stats are yay Ohio for being kind of above the fray, but we're still kind of in it. And then our participating providers see the premature babies and watch them get bigger throughout the visits. What's a good approach? They're armed with resources right now, but what else should they be thinking of when they talk to these families?
Yeah, I would say a big one would be this advocacy piece for families. I think a lot of times, especially women of color, they feel like they can't advocate for themselves, or they don't feel like they have a voice in you know, in a hospital room. And so I think making sure to create space for more questions, or just have some resources on hand. I think about, you know, in Cleveland, we have Birthing Beautiful Communities. It's a Black-owned birthing center, and just to allow women to just be able to have access to different resources like that, I think would be really helpful when it comes to that education piece or the advocacy piece.
It's good. Maybe our participants can incorporate some of the trainings that you offer too for their staff to increase knowledge.
Mm-hmm. Yeah.
Any questions or anything to share? Okay, if you think of anything, just like all of the presentations so far, you can email me and I can get some answers from our presenters. Bianca, thank you so much for the information.
Yeah, thanks for having me.
Okay, so next steps for the group, please continue to use the Seek screening tool and caregiver feedback survey. You saw in the data that you are doing a great job for your patients and caregivers, so keep that up. And then it is time for the second PDSA worksheet, and then for you to talk to me again about your data and your PDSA and how you're doing in the program. So if you could schedule your next practice coaching call with me, that would be great. If you have done so already, I appreciate it. And then the next action period call, the fifth one of the program, is going to be Wednesday, April 10th at noon. We will be recording for viewing later if you cannot make it. And any questions for me about the program or our presenters today? Okay, as you know, I'm an email away, so if you think of anything, please let me know, but I can give you some time back today. Thank you all for joining and I appreciate you. Have a good week.